The Nine Needles of Classical Acupuncture, exploring the historical significance and therapeutic functions of the nine needles in classical acupuncture. Classical acupuncture is a time-honored healing art that originates from ancient Chinese medicine, emphasizing the importance of harmonizing qi within the body. This practice employs diverse methods, including the foundational nine needles, to facilitate wellness and alleviate a variety of health issues. Historical background of acupuncture, an overview of the evolution of acupuncture techniques and tools through time. Prehistory, moxibustion and bleeding techniques were used before the introduction of needles in healing practices, indicating early forms of energy manipulation. Neolithic period, the earliest needle, a lance needle, was discovered, marking a significant advancement in healing tools and practices. Han Dynasty. By this time, nine distinct needles were developed, each designed for various therapeutic functions, forming the basis of classical acupuncture practices. The nine needles overview. The chisel needle with the maximum depth of 1.6 tun is primarily used for moving yang qi and stimulating wei qi, particularly effective in treating conditions like wind cold and wind damp. It employs a chiseling technique that focuses on the sinew channels. Round needle, measuring 1.6 tun, is designed to bring deeper issues to the surface, typically used for needling points like GB41 to dredge daimai. It is effective for bee obstruction and notably does not pierce the skin. The spoon needle at 3.5 tun stimulates qi at the surface and entices energy upward. This needle supports wei qi and is utilized similarly to gua sha, ensuring no penetration of the skin during treatment. The lance needle, known as the three-edged needle, is 1.6 tun long and primarily used for bloodletting, addressing chronic bee obstruction while effectively bringing yang energy to the affected area. The sword needle, measuring 4 tun, utilizes a circling technique for opening points. It is primarily employed to drain pus from boils or abscesses, with specific insertion depth of only 2.5 fun. The round sharp needle at 1.6 tun is adept at seizing qi to treat P obstruction. Its success is rooted in the practitioner's self-cultivation, emphasizing the importance of relaxation and energy flow during treatment. The hair needle, measuring 3.6 tun, is used for threading, connecting points with shallow insertion. By nourishing and expelling pain, it is effective for chronic numbness with long retention. The long needle at 7 tun is specifically tailored for treating numbness and paralysis in the low back, addressing deep abdominal conditions and alleviating wind in the joints. The big needle, measuring 4 tun, is comparable to a wood chisel and is used to drain dampness near major points, addressing deep pathological factors related to P syndrome. The chisel needle, with a maximum depth of 1.6 tun, is intricately designed to facilitate the movement of yang qi and stimulate wei qi. This needle is primarily employed to address conditions such as wind cold and wind damp, utilizing a chiseling technique along the sinew channels for effective treatment. The round needle, measuring 1.6 tun long, rounded tip that allows for effective treatment without piercing the skin. This technique is particularly useful for bringing deeper issues to the surface, such as when needling GB41 to dredge the daimai, and is beneficial for alleviating conditions like P obstruction. The spoon needle, measuring 3.5 tun, is designed specifically for surface stimulation without penetrating the skin. It utilizes wrist movements to either entice qi to the surface or stimulate yang qi, enhancing the body's defensive energy and functioning similarly to a gua sha tool in its application. The lance needle, measuring 1.6 tun long, features a sharp three-edged design that allows it to effectively perform bloodletting procedures. It is particularly useful for treating chronic P obstruction, as it helps to disperse stagnant qi and promote the flow of yang energy to the affected area. Over time, this needle has been largely supplanted by modern lancets, but remains significant in the practice of classical acupuncture. The sword needle, measuring 4 tun in length, employs a circling technique to effectively open acupuncture points. Its primary purpose is to drain pus from boils or abscesses, making it a crucial tool in addressing infections and promoting healing. Due to its specific design and technique, it is inserted only 2.5 fun, 0.25 tun, to minimize discomfort while maximizing therapeutic effect. The round sharp needle, measuring 1.6 tun in length, is specifically crafted to seize and manipulate qi during acupuncture treatments. It is particularly effective for alleviating qi obstruction and relies heavily on the practitioner's self-cultivation and ability to achieve ta qi, which enhances the therapeutic outcomes of the treatment. Techniques such as gentle insertion and mindful engagement with the patient's qi are crucial for optimal results. The hair needle, measuring 3.6 tun long, is utilized for very shallow insertions, effectively connecting acupuncture points. This technique is particularly beneficial for nourishing the body and expelling pain, making it ideal for treating chronic numbness and facilitating energy flow over extended retention periods. The long needle, measuring 7 tun, is specifically designed to address conditions of numbness and paralysis, particularly in the lower back. It is also effective for treating deep abdominal conditions and alleviating wind in the joints, utilizing deep insertion techniques to penetrate fleshy areas and reach stagnant tumors. The big needle, measuring 4 tun in length, is characterized by its thick, wood chisel-like structure. It is specifically designed to drain dampness near major joints, making it effective in treating deep pathological factors associated with P syndrome, which often results in pain and stiffness in the joints. Techniques of insertion in acupuncture. Gentle insertion techniques are crucial in acupuncture practice as they foster a relaxed environment for the patient. A calm approach helps the body accept the needle, facilitating the flow of qi and enhancing the overall effectiveness of treatment. Guide tubes can be utilized to ensure precise needle placement while minimizing discomfort for the patient. By pressing the guide tube against the skin, the acupuncturist can deliver the needle smoothly, reducing anxiety and creating a more pleasant experience. Techniques that involve aggressive insertions, such as tapping or flicking the needle, can provoke the body's wei qi, leading to resistance and discomfort. It's important to adopt a gentle approach, allowing the patient's qi to accept the treatment without defensive reactions. The 9 needles represent a foundational aspect of classical acupuncture, showcasing a variety of treatment modalities and techniques, from superficial stimulation to draining abscesses and addressing deep pain syndromes. These needles illustrate the integrative approach of ancient acupuncture in addressing a wide range of health issues, emphasizing the importance of both physical and energetic regulation in healing. Summary table of the 9 needles. Each needle serves a specific therapeutic purpose, reflecting the depth and versatility of classical acupuncture. Chansen for superficial stimulation. Yuan Chen, massage and pressure. Ti Chen, meridian pressing. Feng Chen, bloodletting. Pi Chen, drain abscesses. Yan Li Chen, relieve stagnation. Hao Chen, standard acupuncture. Chang Chen, deep disorders. Pa Chen, drain fluids.